Hi, today we're talking about GERD and treatment of GERD. Now, GERD is an acronym for Gastroesophageal Reflux Disease, and we discussed its causes and its complications in earlier videos. Today we will focus on the treatment. GERD is a very common disorder, and many patients go to see their primary care doctors or they go to see the gastroenterologist with complaints of GERD and the symptoms of GERD. GERD is usually treated with lifestyle changes and weight loss and medications. And if you are suffering from symptoms of GERD, if you have to take medication more than 2 times a week, or the GERD symptoms that you have are persistent and chronic and they are affecting your quality of life, then most doctors would start a patient with symptoms like that on a PPI, which is a proton pump inhibitor. It's a medication that suppresses the production of acid in the stomach, and this would be the medication that is given a try at the onset of the symptoms, at the onset of the complaints. And this would usually be accompanied by recommendations for lifestyle changes. Lifestyle changes remain the cornerstone of treatment of GERD. And lifestyle changes would include fixing the diet. And doctor would recommend to patients with GERD to avoid those foods that trigger the symptoms, such as tomatoes, acid fruit like citrus, certain fatty fried foods like fast foods, french fries, bacon, sausages, hamburgers, as well as carbonated drinks that can trigger GERD and that can intensify the symptoms of GERD, as well as spicy foods. And patients should also avoid alcohol and smoking, because these are all things that make the complaints, make the symptoms of GERD worse. And patients therefore should take this as a first step along with the PPIs that are prescribed for them. Now, if this regimen does not work on its own, physicians would then increase the dose of the PPI, or they may divide it up over the day so that instead of the patient taking it once per day, they would then start taking it 2 times, 3 times, maybe even 4 times a day. And the physician would also make sure that the medication is being taken on a regular basis and that is being taken at the correct time, which is it should be taken half an hour to 1 hour before a meal. These treatments, this initiation of treatment, would only take place if the doctor is sure that the patient is not complaining of alarm symptoms. And alarm symptoms are symptoms that accompany GERD, such as painful swallowing, odynophagia, or difficulty swallowing, or weight loss, or severe chest pain. If any of these alarm symptoms accompany the symptoms of GERD, the doctor would then send them to do an endoscopy first before starting medication. Another intervention, lifestyle intervention, that has been shown to affect GERD and to relieve the symptoms of GERD is sleep. And sleep by itself can decrease the frequency of transient lower esophageal sphincter relaxation. Transient lower esophageal sphincter relaxations are physiological relaxations of the muscle that controls the passage of food from the esophagus into the stomach. This muscle, as you can see here on the diagram, is located right at the junction of the esophagus and the stomach. And as food makes its way down the esophagus into the stomach, this lower esophageal sphincter, the muscle that controls the opening of the stomach and of the closure of the esophagus, relaxes so that the food can pass freely into the stomach. So sleep can prevent the inappropriate spontaneous relaxation of the lower esophageal sphincter that we know sometimes presents in people who are suffering from GERD and reflux symptoms. Apart from that, a patient with GERD can place blocks on the legs of the head of the bed to elevate the bed, and this would assist with preventing reflux and preventing the backup of food and acid back into the esophagus. They would also be advised by their doctor not to eat anything for 3 hours prior to lying down to sleep. And patients would also be advised not to lie in a right side of their body, in a right lateral position, because this position, lying on the right side, is associated with more GERD symptoms and more reflux. If these do not work, the doctor can then consider other interventions, but he would also advise the patient to lose weight, because being overweight and especially having abdominal obesity, increases the intra-abdominal pressure, and the intra-abdominal pressure is transmitted to the stomach, and this forces food out of the stomach into the esophagus and aggravates the GERD, and in some cases causes the GERD and makes the symptoms worse. There are studies that show that women who lose as little as 3.5 units of their BMI can improve their GERD symptoms by 40%. So weight loss, along with the other interventions, is a very effective way of managing GERD and GERD symptoms. Other interventions would be adding other medications to the PPI. The doctor can add antacids, Maalox, Mylanta. He can add H2 receptor blockers, such as Pepsid or Tagamet, and these are medications that can help to suppress acid in patients with GERD taking PPIs. If those do not work, the doctor can then resort to motility agents, and motility agents are agents that act on the wall of the gastrointestinal tract to increase the motility, the peristalsis of the gastrointestinal tract, including the esophagus. And by so doing, they increase the tone, the muscle tone of the sphincter, the ring of muscle that controls the entrance from the esophagus into the stomach. And by tightening that, by increasing the tone, it can prevent the backup, the regurgitation of acid and food back into the esophagus. That is a hallmark of acid reflux and GERD. Motility agents include agents such as Prevacid or Reglan, metoclopramide, and these medications, as I mentioned, can be added to PPIs to help control GERD symptoms. In the event these no longer are working along with the other medications that have been started, doctors can then perform studies to further evaluate and see if the patient has other conditions that could be leading to gastroesophageal reflux disease, such as they may have esophageal hypersensitivity, and that means that the wall of the esophagus is sensitive to acidic and non-acidic fluids that make their way from the stomach and from the small bowel back into the esophagus. And doctors treat that condition with antidepressant drugs, such as tricyclic antidepressant drugs, or the class of antidepressant drugs that we call SSRIs. For example, Celexa, citalopram can be used to treat this type of GERD. Finally, as far as medications go, doctors may use an alginate. Alginates are substances that are derived from seaweed, and when alginates come into contact with water, they form a thick, viscous gum, and this gum floats on the surface of the fluid in the stomach and forms a layer of insulation between the acid and the proximal portion of the stomach and the esophagus, which joins and enters the stomach in the proximal portion, so that acid is not able to make its way back into the esophagus to cause GERD symptoms. And this medication can be added similarly to the other medications in a similar fashion to the PPIs that are the mainstay of therapy for GERD. Very infrequently, doctors refer certain categories of patients for surgical intervention. And laparoscopic fundoplication, which is one of the more common procedures that is performed for GERD, involves laparoscopic wrapping of the fundus of the stomach, the upper part of the stomach, around the base of the esophagus, and that is then sutured in position. This supports the lower esophageal sphincter. It tightens it, and that prevents acid and prevents food from making its way through that valve back into the esophagus to cause the symptoms of GERD. A second laparoscopic procedure is the Linx procedure, in which titanium balls with a magnet form a ring, and that ring is placed around the outside of the esophagus, around the outside of the lower esophageal sphincter, where it supports the sphincter and tightens the sphincter and prevents regurgitation, prevents acid reflux. PPIs are the gold standard of treatment of acid reflux and GERD. However, PPIs have been associated with side effects that cause concern in patients. Side effects such as vitamin B12 deficiency, magnesium deficiency, frequent bone fractures, atrophic gastritis, so that more and more people are moving towards endoscopic treatment of their GERD. At the same time, older procedures such as fundoplication, the surgical treatment, is falling out of favor because after fundoplication, a large proportion of those patients end up still taking PPIs and acid suppression medication. Now, those endoscopic procedures that are becoming more popular include the TIF procedure, in which the angle of the esophagus to the stomach is corrected. That angle is called the His angle. And by creating a valve at the junction of the stomach and the esophagus, endoscopically, doctors are able to correct that angle and improve the function of the lower esophageal sphincter, thereby preventing GERD and reflux. A second procedure that is done is by using the Stretta device, which is a balloon catheter with needles on it that is inserted into the esophagus down to the lower esophageal sphincter, where it delivers radiofrequency energy. This energy causes the lower esophageal sphincter to thicken, and that improves the function of the lower esophageal sphincter. Beyond that, it suppresses the transient lower esophageal sphincter relaxations that we know underlie GERD and acid reflux in certain patients. So these procedures can be used in addition to the medications, in place of medications, depending on the category of patient that a doctor is treating. I hope this video has provided insight into the management, the medical management, and the surgical management of GERD and acid reflux. Subscribe to this channel for more useful tips on healthy living. And thank you for watching.